Your body depends on sebaceous glands, which sit just under your skin. These glands secrete an oily substance called sebum, which coats your skin and hair to prevent them from drying out. Sebum travels up hair follicles and out through your pores onto the surface of your skin. Your hair follicles routinely shed dead skin cells, which sebum carries out of your body. When your body produces extra sebum and dead skin cells, they can stick together and clog your pores, resulting in skin blemishes. Then bacteria that normally exist in small amounts on your skin can flourish in the sebum in the clogged pore, leading to inflammation. Depending on where the clog is located and if you have inflammation, acne may appear as whiteheads, which are clogged follicles closed off from the air. Blackheads, which are clogged follicles that turn a darker color when the clog is exposed to air. Pustules, commonly called pimples, which are inflamed follicles clogged with pus. Or cysts, which are larger, painful, pus-filled lumps going deep under the skin. Hormonal changes, particularly a rise in testosterone, can lead to sebum overproduction, which is why acne often occurs during the teen years. However, it can occur at any age. Other factors contributing to the development of acne are bacteria, certain medications, and genetics. If you have a mild case of acne, your doctor may recommend an over-the-counter lotion with one of several active ingredients. Benzoyl peroxide kills bacteria, dries excess oil, and removes dead skin cells clogging pores. Salicylic acid slows the loss of skin cells to prevent clogged pores. It may also break down whiteheads and blackheads. Alpha-hydroxy acids, such as lactic acid, help remove dead skin cells, reduce inflammation, and stimulate the growth of new, smoother skin. Sulfur removes dead skin cells and dries excess oil. These are strong chemicals that may irritate your skin. Follow the directions for use exactly. If over-the-counter products are not effective, your dermatologist may prescribe stronger prescription lotions such as vitamin A, which reduces the buildup of dead skin cells in your pores, topical antibiotics, which kill bacteria on your skin, or a combination of benzoyl peroxide and topical antibiotics. For moderate to severe cases, your dermatologist may prescribe an oral medication alone or in combination with a topical treatment. These medications include oral antibiotics, which kill bacteria and reduce inflammation, and isotretinoin, which is used only for the most severe cases. A corticosteroid injection may be given to relieve your pain and help clear up a particularly large lesion. For women, birth control pills containing estrogen may be prescribed to minimize the effects of testosterone. Regardless of the treatment your doctor recommends, good skin care is essential. For example, wash problem areas twice daily with a mild soap and wash gently without scrubbing. If you have dry or peeling skin, use an oil-free, water-based moisturizer. When choosing any product to put on your skin, look for an oil-free or non-comedogenic label, which means it won't clog your pores. Avoid picking or squeezing blemishes, as these actions may lead to infection or scarring. And avoid touching your face with your hands, your hair, or any object, such as a cell phone.
You might be in a state where you are getting pimples often, and you really want to know what causes pimples. You've tried everything you possibly could, but your pimples never appear to stop forming on your face. Well, there are thousands of people with the same problem as you have now. It just seems like these pimples won't ever stop coming on your face. Pimples appear due to a certain cause, and when treated correctly they go very soon. There are a few things that led to the growth of pimples on your face. If you know them, you can understand what are the things you are doing wrong, and what causes pimples. But before I proceed further to tell you the causes of pimples, let us first understand what is a pimple, so that you will understand the entire article easily. What is a pimple? A small pustule or papule is considered to be a pimple. Pimples occur on your face when oily glands get clogged and infected. Dead cells of the skin, clogged pores, oily glands, and bacteria are the reason why pimples occur. When these oil glands get clogged and are infected, they swell and become small lesions filled with pus inside, primarily known as pimples. Life of a pimple. The life of a pimple can be anywhere between 2 days to a week. You can expect your pimple to go off anytime within this period. If you are lucky, it may take up to 2 days for a pimple to disappear completely, or it might take up to a week to go. It's always beneficial if you do something about the pimple from the moment it starts to show up on your face. This will help you get rid of that pimple pretty soon enough. You can take a few necessary measures which will help you reduce your pimple growth. What causes pimples? Number 1. Genetics is considered to be one of the things that trigger pimple formation. Your family history can make you understand how often you will get pimples. Number 2. The sebum, oil, that is produced on your skin can also lead to pimple growth. The dead skin cells which are shed from the follicle and the skin bacteria with the presence of sebum make a clog, which can lead to the cause of a pimple. Number 3. Puberty is the age when most of you guys will start to develop skin-related problems. Androgens are the hormones which your body produces when you are in your puberty. It's all part of your body's natural development stages. Due to these hormones, a gland called sebaceous begins to enlarge. All these changes at the puberty age trigger skin problems. Flare-ups during the menstrual cycle and during pregnancy are also caused by androgens. Number 4. Bacteria is always present on your skin. When a follicle is plugged, multiple growths of acne bacteria starts to happen, which in return creates a reaction near the surrounding skin and inflammation occurs in the follicle. Number 5. When bacteria comes in contact with an already existing pimple, it makes the pimple red and swollen and sometimes painful. This might happen when you try to pop a pimple with your fingers. The bacteria on your fingers may get into the pimple and might lead to cause the problem. Conclusion. Pimples are often to occur when you are at the age of puberty. Even if you are done with puberty changes and yet if you are getting pimples, don't worry. It's all a part of what's happening inside the skin. Still, you can manage to keep your pimple away, or make it go faster by taking necessary measures. Thank you for watching this video. Subscribe to this channel and get daily health tips.